This is our patient, Jihan. She's a 30-year-old female that's been referred by an optometrist due to a family history of glaucoma and thinning of the retinal nerve fibre layer, which was seen on the OCT. Jihan has come to the orthoptic-led glaucoma screening clinic to do further testing. In this video, we will demonstrate a Goldmann visual field as conducted in this simulated clinic environment.
Jihan.
Pineapple.
Yeah. Hi, come on in. Hey. So, hi, Jihan. How are you today?
Good, how are you?
That's good. If you could just take a seat.
Yeah, sure.
So, my name is Nolene. I'll be your orthoptist for today. Just quickly confirming your date of birth.
So, the 21st of the 1st, 1997.
Yeah, that's okay. So, today we're just going to be doing a visual field test. So, it's pretty much what you can see to the left and to the right and top and bottom while you're looking straight ahead.
Yeah.
So that's just what we're doing today.
Yeah.
The Goldmann visual field is a subjective measure of a patient's monocular visual field with the head stationary in primary position. The visual field is the extent of vision a person can see to the periphery as they fixate centrally. The normal parameters of a monocular visual field extends from the center out to approximately 60 degrees in the nasal and superior directions, approximately 100 degrees temporally, and approximately 75 degrees inferiorly. The Goldmann perimeter is a type of kinetic visual field test, which means that the stimulus of known luminance and size is selected and moves all around the visual field. This allows us to mark the extent of the patient's visual field, which is known as the threshold.
There are different areas of sensitivity on the retina, and this can be represented by trachea's hill of vision. The peak of the hill marks the fovea of the retina where it is most sensitive to light due to the high density of cone cells, meaning it can respond to a stimulus of small size with a low luminance, compared to the foot of the hill, which represents the peripheral retina where cone cells are limited in number. Therefore, this area of the retina is less sensitive to light. Thus, a stronger luminance is needed for the observer to notice the stimulus. Following this principle, the examiner then can manipulate the size and the luminance of the stimulus to map out different areas called isopters on the visual field. On this diagram, each rings on the visual field represents different isopters, each mapped out by different stimulus of size and luminance. Also note that each isopter has its own threshold.
Using the Goldmann, we're able to map out an individual's visual field and note any defects in which we could have been caused by underlying conditions or diseases affecting the patient's vision.
First, we have the pentoscopic arm, which allows us to control the movement of the stimulus. Then we have the telescope, which allows us to monitor fixation of the patient. The patient's inverted eye can be seen through the telescope to monitor fixation. This is the table for stimulus combinations, which is where we choose the size and luminance for the stimulus. Next, we have the shutter, which allows us to control the on and off projection for the stimulus. Then we have the horizontal and vertical chin rest adjustments. Then we have the marking sheet slots. Lastly, the on-off button for the Goldmann machine is located to the examiner's right at the side of the machine. We have the chin rest, the head rest, the lens holder, the fixation target, the buzzer, the pentoscopic arm, which also projects the stimulus, and lastly, the illumination of the globe.
Goldmann recording sheet, eye patch, trials lens set, tissues, and alcohol wipes. To set up the Goldmann, slide the recording sheet under the chart. Make sure that the horizontal line on the recording chart matches with the horizontal notch on our chart, and the same with the vertical. Tighten the recording sheet in place so that when you are recording, it does not move along. Change the light stimulus by moving the dial to Roman numeral 1 for the smaller size, to number 4 for the brightest light, and changing it onto E.
So Jihan, have you ever done a visual field test before? They're really quick and easy. I'll just quickly set up the machine for you. So I'll clean up the iPad first for you. and then we'll just set up the machine. If you could just put your chin on this chin rest and the head on the headrest, and I'll just set up the machine to your height.
Yep.
So if you could just put your head down, is it comfortable or do you want the table any higher?
Just a bit higher.
A bit higher? If you could just sit back for me, we'll just adjust the table. So just put your chin down again. Is that high enough for you?
Yeah, just a bit lower.
A bit lower? Okay, just sit back again for me. Try again. Is that one fine?
Yeah.
Yep. So I'll just see your eyes centered, so just keep staring straight ahead for me. And I'm just going to be moving this chin rest to the side and up and down. And keep looking straight ahead. Okay, yep, that's perfect. You can sit back for me now. And I'll just quickly put an eye patch over your left eye. So we'll be testing your right eye today. So I'll quickly clean this for you. Move up down. And just keep looking at this eye patch on you. Just look over here. Yep. Is that comfortable for you?
Yep.
Okay, Jihan, I'll just bring the light in from the outside, so just press the buzzer for me when you first see the light. Okay. Right, and just tell me if it disappears at any stage. Can you still see it?
Yeah.
Okay, that's great. So just again, moving it to a new spot, tell me when you first see the light. Right, and tell me if it disappears at all. No. Okay. Right, so just again, tell me when you first see the light.
It is very important to know how to properly record your results. First, always check your patient's details, the names and the date of birth. Also, include the date of the test, the examiner's signature, and some comments about fixation and which eye is it tested on. Be sure to mark your stimulus at the stimulus table, which is located at the bottom right of the page. Note that the stimulus used here is a 4,4E, and this is only for video purposes. A normal stimulus used in the standard Goldmann test is a 1,4E. Always connect the dots that you plot on the visual field. This way, we can mark the threshold of the isopter. It is very noticeable that a constricted visual field is observed here, but this is only due to the illumination of the room, which is turned on for video purposes. The static test is an optional test to be done at the end of the kinetic Goldmann visual field test. This is to check the quadrants of the marked visual field to see if anything is missed. The Goldmann is built in a way that the pentoscopy arm can only move freely in half of the chart at a time. To access the other half of the chart, you have to bring the arm to the very top and proceed to bring the arm out and down, like you are tracing the outskirts of the chart. This way you can have access to the other half of the chart to continue marking your visual field.